Question 1. Process analysis reveals that an 82-year-old client, diagnosed with mild cognitive impairment and early-stage glaucoma, insists on continuing to drive their personal vehicle to maintain independence. The client's adult children have expressed significant concerns about their parents' driving safety, citing instances of near misses and difficulty navigating familiar routes. As a certified geriatric care manager, what is the most appropriate initial step to address this complex transportation issue? Option A. Accept the client's assertion that they are a competent driver and reassure the family that no further action is needed at this time. Option B. Inform the client's adult children that their concerns are valid and suggest they take away the client's car keys to prevent them from driving. Option C. Recommend a comprehensive driving evaluation by a certified driving rehabilitation specialist and consult with the client's primary care physician to discuss the medical implications of their conditions on driving. Option D. Advise the client that based on their age and diagnosis, they are no longer safe to drive and arrange for alternative transportation services immediately. The correct answer is C. Recommend a comprehensive driving evaluation by a certified driving rehabilitation specialist and consult with the client's primary care physician to discuss the medical implications of their conditions on driving. Explanation. This scenario presents a common challenge for geriatric care managers, balancing a client's expressed preference with their safety and well-being, particularly when transportation is involved. The core professional challenge lies in respecting client autonomy while ensuring their physical safety and adherence to any applicable regulations or best practices for elder care transportation. The Certified Geriatric Care Manager, CGCM, must navigate potential cognitive impairments, physical limitations, and the client's desire for independence. The correct approach prioritizes a thorough assessment of the client's current driving ability, considering both objective factors, medical conditions, vision, reaction time, and subjective observations, driving history, family concerns. This aligns with the CGCM ethical obligation to act in the client's best interest and to advocate for their safety. It also reflects the professional standard of care, which mandates a comprehensive evaluation before making recommendations that impact a client's independence and safety. Consulting with the client's physician is crucial for obtaining objective medical data and professional medical opinion, which is a cornerstone of evidence-based geriatric care management. This collaborative approach ensures that decisions are informed by medical expertise and are documented, providing a defensible basis for recommendations. An incorrect approach would be to immediately accede to the client's request without a proper assessment. This fails to uphold the CGCM duty of care and could lead to a dangerous situation, potentially resulting in an accident. Ethically, this would be a breach of professional responsibility, as the CGCM is expected to identify and mitigate risks. Another incorrect approach would be to unilaterally decide the client can no longer drive without involving the client or their physician. This disrespects client autonomy and bypasses essential medical consultation, which is a regulatory and ethical failing. It also undermines the collaborative nature of care planning. Finally, simply relying on the client's assertion that they are a good driver without any objective verification or professional input is negligent and fails to meet the standard of care expected of a CGCM. The professional decision-making process for similar situations involves a systematic approach. 1. Identify the core issue, transportation safety and client autonomy. 2. Gather information through assessment, client interview, observation, family input, medical records. 3. Consult relevant professionals, physician, potentially a driving rehabilitation specialist. 4. Evaluate risks and benefits of different options. 5. Develop a care plan collaboratively with the client and their support system, prioritizing safety while maximizing independence. 6. Document all assessments, consultations, and decisions. Question 2. Market research demonstrates that certified geriatric care managers, CGCM, often face requests from family members for detailed updates on a client's health status and care plan. A CGCM receives a call from an adult child of a client, who is not the designated healthcare proxy, asking for specific details about the client's recent medical appointments and medication changes. The client has not provided any written authorization for the CGCM to share this information with this particular family member. What is the most appropriate course of action for the CGCM? Option A. Share general information about the client's overall well-being and progress, omitting specific medical details to be helpful without violating privacy. Option B. Politely decline to answer any questions, stating that all communication must go through the client directly without offering any further explanation or assistance. Option C. Provide the family member with the requested information, assuming that as a close family member involved in care, they have an implied right to know. Option D. Inform the family member that due to client confidentiality regulations, specific details cannot be shared without the client's explicit, written consent, and offer to facilitate a discussion with the client about what information they are comfortable sharing. The correct answer is D. Inform the family member that due to client confidentiality regulations, specific details cannot be shared without the client's explicit, written consent, and offer to facilitate a discussion with the client about what information they are comfortable sharing. Explanation. Market research demonstrates that certified geriatric care managers, CGCM, frequently encounter situations where family members, while well-intentioned, request information about a client that the CGCM is legally and ethically bound to protect. This scenario is professionally challenging because it requires the CGCM to balance the desire to be helpful and transparent with family members against their paramount duty to uphold client confidentiality and privacy rights. Navigating these requests demands a nuanced understanding of applicable regulations and ethical principles, as well as strong communication skills to manage expectations without alienating key stakeholders. The correct approach represents best professional practice because it prioritizes the client's autonomy and legal rights to privacy. By seeking explicit, informed consent from the client before disclosing any information, the CGCM adheres strictly to the principles of client-centered care and respects the boundaries established by privacy regulations. This proactive step ensures that any information shared is done so with the client's full awareness and agreement, thereby preventing breaches of confidentiality and maintaining trust. An incorrect approach that involves sharing information with a family member without the client's explicit consent, even if the family member is the primary caregiver, represents a significant regulatory and ethical failure. This action directly violates the client's right to privacy and confidentiality, which are protected by regulations such as HIPAA, Health Insurance Portability and Accountability Act. In the United States, such a breach can lead to legal repercussions, damage the CGCM professional reputation, and erode trust with the client and their family. Another incorrect approach, which is to assume that because a family member is involved in care, they automatically have access to all client information, is also a critical failure. This assumption disregards the legal framework that designates the client as the holder of their own information, unless they have legally authorized otherwise. It bypasses the necessary consent process and exposes the CGCM to liability. A third incorrect approach, which is to refuse to communicate with the family at all, even to explain the limitations on information sharing, is also professionally suboptimal. While maintaining confidentiality is crucial, a complete refusal to engage can create unnecessary friction and misunderstanding. A more ethical and professional approach involves explaining the confidentiality obligations to the family in a clear and empathetic manner, without disclosing client-specific details, and guiding them on how to obtain consent from the client for information sharing. The professional decision-making process for similar situations should involve a clear understanding of the client's consent status regarding their protected health information. CGCM must first ascertain if they have a valid release of information or power of attorney that grants the family member access. If such authorization is absent, the CGCM primary responsibility is to uphold client confidentiality. The next step is to communicate professionally and empathetically with the family member, explaining the legal and ethical obligations regarding client privacy without revealing any protected information. The CGCM should then guide the family on how the client can provide consent if they wish to share information, empowering the client to control their own privacy. Question 3. The performance metrics show a consistent pattern of elevated blood glucose and blood pressure readings for a long-term client with both diabetes and hypertension. The client expresses satisfaction with their current lifestyle and states they are taking their medications as prescribed, though direct observation of adherence is limited. What is the most appropriate initial step for the certified geriatric care manager to take in addressing these suboptimal performance metrics? Option A. Inform the client's adult children about the concerning performance metrics and suggest they intervene more directly in the client's daily health management. Option B. Conduct a comprehensive risk assessment to identify specific barriers to optimal chronic condition management, exploring factors such as medication understanding, dietary habits, physical activity levels, and potential psychosocial influences, and then collaboratively develop a revised care plan with the client and their physician. Option C. Document the performance metrics and forward them to the client's physician with a note stating the client claims to be compliant, without further direct investigation or client engagement. Option D. Immediately recommend an increase in the dosage of the client's diabetes and hypertension medications to the prescribing physician, based solely on the performance metrics. Correct answer is B. Conduct a comprehensive risk assessment to identify specific barriers to optimal chronic condition management, exploring factors such as medication understanding, dietary habits, physical activity levels, and potential psychosocial influences, and then collaboratively develop a revised care plan with the client and their physician. Explanation. This scenario presents a common challenge for geriatric care managers, balancing client autonomy with the need for effective chronic condition management, particularly when performance metrics indicate suboptimal outcomes. The core tension lies in respecting the client's right to make decisions about their health while ensuring they receive the best possible care to maintain their quality of life and prevent complications. A geriatric care manager must navigate this delicate balance by employing a risk assessment approach that is both client-centered and compliant with professional standards and ethical guidelines. The correct approach emphasizes a comprehensive, individualized risk assessment. This involves gathering detailed information about the client's current health status, lifestyle, understanding of their conditions, adherence to treatment plans, and any barriers they face. By identifying specific risks, e.g., medication non-adherence due to cognitive impairment, dietary challenges, lack of social support for exercise, the geriatric care manager can then develop targeted interventions in collaboration with the client and their healthcare team. This approach aligns with the ethical principles of beneficence, acting in the client's best interest, and autonomy, respecting their choices, while also adhering to the professional standards of care that require proactive management of chronic conditions to prevent adverse events. The focus is on empowering the client and addressing the root causes of suboptimal performance metrics. An incorrect approach that focuses solely on increasing medication dosage without a thorough assessment fails to address potential underlying issues and could lead to adverse drug reactions or patient distress, violating the principle of non-maleficence. It also disregards the client's potential reasons for non-adherence or the effectiveness of current treatment, potentially undermining their trust and engagement. Another incorrect approach that involves solely reporting the performance metrics to the physician without further investigation or client engagement is a missed opportunity for proactive care. While physician notification is important, it should be part of a broader strategy to understand and address the issues, not a standalone solution. This approach can be seen as a passive response rather than active case management. A third incorrect approach that involves assuming the client is intentionally non-compliant and escalating to family without prior discussion with the client is a significant ethical and professional failing. It violates the client's privacy and autonomy and can damage the therapeutic relationship. Such an assumption bypasses the crucial step of understanding the client's perspective and potential barriers. A professional decision-making process for similar situations should always begin with a client-centered, comprehensive assessment. This involves active listening, open-ended questioning, and a non-judgmental attitude. The geriatric care manager should then collaboratively develop an action plan with the client, involving their healthcare providers as necessary. Regular reassessment and adjustment of the plan are crucial. Documentation of all assessments, interventions, and client communications is paramount for accountability and continuity of care. Question 4. Operational review demonstrates that a certified geriatric care manager, CGCM, is developing a comprehensive care plan for an elderly client who has expressed a desire for their adult children to be involved. However, the client has also indicated that they wish to maintain ultimate decision-making authority regarding their personal care preferences. One of the adult children has contacted the CGCM, expressing significant concerns about the client's current living situation and advocating for a move to an assisted living facility, a decision the client has repeatedly stated they are not ready for. The CGCM needs to determine the most appropriate next step in the care planning process. Option A. Inform the adult child that their concerns are noted, but that the client's wishes are paramount, and that the CGCM will proceed with the care plan based solely on the client's stated preferences, without further family consultation. Option B. Proceed with developing the care plan based on the adult child's recommendation for assisted living, assuming that as the client ages, their capacity will diminish, and this is a proactive measure to ensure their safety. Option C. Immediately begin drafting a care plan that includes a transition to assisted living, as this is the most pressing concern raised by the adult child and appears to be in the client's best interest for safety. Option D. Schedule a meeting with the client and all involved adult children to discuss the care plan, clearly outlining the client's right to make final decisions and seeking the client's explicit consent for the scope of family input. The correct answer is D. Schedule a meeting with the client and all involved adult children to discuss the care plan, clearly outlining the client's right to make final decisions and seeking the client's explicit consent for the scope of family input. Explanation. Scenario analysis. This scenario presents a common challenge in geriatric care management, where family dynamics and differing perspectives can complicate the care planning process for an aging client. The professional must navigate potential conflicts, ensure the client's autonomy is respected, and adhere to ethical and regulatory standards for informed consent and decision-making, all while fostering a collaborative environment. The challenge lies in balancing the family's desire to be involved with the client's right to self-determination and the professional's duty to provide objective, client-centered care. Correct approach analysis. The correct approach prioritizes direct communication with the client, respecting their wishes and capacity for decision-making. It involves actively seeking the client's consent to involve family members and clearly defining their roles and the scope of their participation in the care plan. This aligns with the ethical principles of autonomy and beneficence, ensuring the client's voice is central to their care. Regulatory frameworks for geriatric care management, particularly those emphasizing client rights and informed consent, mandate this client-first approach. It promotes transparency and builds trust, which are foundational to effective care management. Incorrect approaches analysis. One incorrect approach involves proceeding with family discussions and care plan development without explicit client consent. This violates the client's right to privacy and autonomy, potentially leading to a care plan that does not reflect the client's true desires or needs. Ethically, it breaches the principle of respect for persons. Legally, it could be seen as a failure to obtain informed consent for information sharing and decision-making, which is a cornerstone of healthcare practice. Another incorrect approach is to solely rely on the most vocal or seemingly in-charge family member without verifying the client's wishes or assessing the capacity of other family members to contribute meaningfully. This can lead to a biased care plan, alienate other family members, and disregard the client's preferences if they are not the most assertive communicator. It fails to uphold the professional's duty to conduct a comprehensive assessment and ensure all relevant perspectives, especially the client's, are considered. A third incorrect approach is to dismiss family concerns entirely, even when they are raised respectfully and with the client's best interests in mind. While the client's autonomy is paramount, families often possess valuable insights into the client's history, preferences, and potential risks that a professional may not be immediately aware of. Ignoring these contributions can lead to an incomplete or less effective care plan and can damage the therapeutic relationship with the family, which is often a crucial support system for the client. This approach can be seen as a failure in collaborative care and potentially a breach of the duty of care if it leads to suboptimal outcomes due to overlooked information. Professional reasoning. Professionals should adopt a structured decision-making process that begins with assessing the client's capacity to participate in their care planning. If the client has capacity, their explicit consent is sought for any family involvement. The professional then facilitates open communication, clearly outlining the purpose of family involvement and the client's role. If the client lacks capacity, the professional must identify legal surrogates or designated decision-makers and proceed according to established legal and ethical guidelines for substituted decision-making, always prioritizing the client's known wishes and best interests. Regular reassessment of the client's capacity and ongoing communication with both the client and involved family members are essential throughout the care planning and implementation process. Question 5. Cost-benefit analysis shows that a comprehensive medication review involving direct client assessment, pharmacist consultation, and physician collaboration to identify potential polypharmacy and adverse drug events is often more effective in improving health outcomes and reducing long-term healthcare costs than simply adjusting dosages based on a superficial review of the prescription list. Considering the Certified Geriatric Care Manager, CGCM, role in advocating for client well-being and safety, which of the following approaches best reflects professional best practice in medication review for an elderly client who expresses satisfaction with their current regimen, but exhibits signs of potential medication-related side effects? Option A. Conduct a detailed medication reconciliation, including assessment of the client's understanding and adherence, and collaborate with the client's physician and pharmacist to explore potential adjustments or alternatives if clinically indicated, while respecting the client's stated preferences. Option B. Rely solely on the client's assertion that they are satisfied with their current medications and that side effects are unrelated, without conducting an independent assessment or consulting healthcare providers. Option C. Immediately recommend discontinuing several medications to reduce pill burden and cost, assuming that the client's reported satisfaction is a superficial indicator and that side effects are likely due to polypharmacy. Option D. Proceed with a review of the prescription list to identify the most expensive medications and suggest their discontinuation to achieve cost savings, without a thorough clinical evaluation of their necessity. The correct answer is A. Conduct a detailed medication reconciliation, including assessment of the client's understanding and adherence, and collaborate with the client's physician and pharmacist to explore potential adjustments or alternatives if clinically indicated, while respecting the client's stated preferences. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a geriatric care manager to balance the client's autonomy and preferences with the imperative to ensure their safety and well-being, particularly concerning medication management. The client's resistance to change, coupled with potential cognitive or physical limitations that might impair their ability to manage medications independently, creates a complex ethical and practical dilemma. The geriatric care manager must navigate these factors while adhering to professional standards and regulatory guidelines. Correct approach analysis. The correct approach prioritizes a comprehensive, client-centered medication review that involves direct assessment, collaboration with the healthcare team, and education. This aligns with the ethical principles of beneficence, acting in the client's best interest, and autonomy, respecting the client's right to make decisions about their care. Specifically, it adheres to the CGCM responsibility to conduct thorough assessments, identify potential medication-related problems, and develop individualized care plans. This approach ensures that any proposed changes are evidence-based, tailored to the client's unique needs and circumstances, and implemented with the client's informed consent and understanding, thereby minimizing risks and maximizing benefits. Incorrect approach is analysis. One incorrect approach involves solely relying on the client's stated preferences without further investigation. This fails to meet the CGCM duty of care to identify and mitigate potential risks associated with their medication regimen. It disregards the possibility that the client may not fully understand the implications of their current medication use or may be experiencing side effects they attribute to other causes. This approach could lead to continued polypharmacy, adverse drug events, and suboptimal health outcomes, violating the principle of beneficence. Another incorrect approach is to immediately implement changes based on a quick review of the prescription list, without engaging the client or their physician. This bypasses essential steps in medication reconciliation and management, such as assessing adherence, understanding the rationale for each medication, and identifying potential drug-drug interactions or contraindications. Such an approach disrespects the client's right to be informed and involved in their care, and could lead to unintended consequences or patient dissatisfaction, potentially violating ethical guidelines regarding informed consent and collaborative care. A third incorrect approach is to focus solely on cost reduction by discontinuing medications without a clinical justification. While cost is a factor in geriatric care, it should never supersede clinical necessity or patient safety. This approach neglects the potential therapeutic benefits of the medications and could lead to a decline in the client's health status, creating a greater financial burden in the long run due to increased healthcare utilization. This violates the principle of beneficence and professional responsibility to advocate for the client's optimal health. Professional reasoning. Professionals should approach medication reviews by first establishing a trusting relationship with the client. This involves active listening and validating their concerns. The next step is to conduct a thorough medication history, including prescription, over-the-counter, and herbal supplements, and to observe the client's actual medication-taking behavior if possible. Collaboration with the client's physician and pharmacist is crucial to understand the rationale for each medication, assess its effectiveness, and identify potential problems. Any proposed intervention should be discussed with the client, explaining the risks and benefits clearly, and their informed consent obtained before implementation. This systematic, collaborative, and client-centered process ensures that decisions are ethically sound, clinically appropriate, and aligned with regulatory expectations for geriatric care management. Question 6. Assessment of how a certified geriatric care manager, CGCM, should facilitate interdisciplinary team collaboration for a client with complex medical, social, and cognitive needs, considering regulatory requirements for coordinated care and client privacy. Option A. Rely on individual professionals to document their own interventions and share information only when directly asked by the care manager, assuming they will communicate with each other as needed. Option B. Proactively establish a clear communication plan with all team members, including defined roles, regular documented updates, and a process for addressing concerns, ensuring all information sharing adheres to client consent and privacy regulations. Option C. Share all client information with every member of the interdisciplinary team immediately upon their involvement, assuming implied consent for collaboration. Option D. Primarily communicate through informal verbal exchanges during chance encounters or brief phone calls, documenting only major decisions without a structured process for ongoing team dialogue. The correct answer is B. Proactively establish a clear communication plan with all team members, including defined roles, regular documented updates, and a process for addressing concerns, ensuring all information sharing adheres to client consent and privacy regulations. Explanation. The scenario presents a common challenge in geriatric care management, ensuring effective communication and coordinated care among diverse professionals involved in a client's well-being. The core of this challenge lies in balancing individual professional expertise with the overarching goal of client-centered care, while adhering to regulatory mandates for interdisciplinary collaboration and client privacy. The correct approach emphasizes proactive, documented communication and the establishment of clear roles and responsibilities within the interdisciplinary team. This aligns with the ethical and regulatory requirements for geriatric care managers to facilitate comprehensive care planning, ensure continuity of services, and advocate for the client's best interests. Specifically, it reflects the principles of shared decision-making, informed consent, and the duty to coordinate care as mandated by relevant professional standards and potentially state-specific elder care regulations that govern the scope of practice for certified professionals. This approach prioritizes the client's holistic needs by ensuring all team members are informed and working towards common goals, thereby minimizing the risk of fragmented or conflicting care. An incorrect approach that focuses solely on individual professional documentation without explicit team communication fails to meet the collaborative mandate. This can lead to a lack of awareness of other professionals' interventions, potentially resulting in duplicated services, conflicting advice, or overlooked critical issues. Ethically, this represents a failure to adequately advocate for the client's comprehensive needs and can violate principles of coordinated care. From a regulatory standpoint, it may fall short of requirements for interdisciplinary team communication and care planning. Another incorrect approach that involves sharing client information without explicit consent, even with other professionals on the team, constitutes a significant breach of privacy regulations, such as HIPAA in the U.S. context. While collaboration is essential, it must always be conducted within the strict boundaries of client confidentiality and informed consent. Unauthorized disclosure of protected health information is a serious ethical and legal violation, leading to potential disciplinary action and loss of licensure. A third incorrect approach that relies on informal, undocumented communication among team members, while seemingly efficient, lacks accountability, and can lead to misunderstandings or omissions. Without a documented record of discussions, decisions, and action plans, it becomes difficult to track progress, identify responsibilities, or address disputes. This can undermine the integrity of the care plan and leave the care manager vulnerable to liability if issues arise due to a lack of clear communication protocols. It fails to establish a robust framework for accountability and transparency, which are critical for effective interdisciplinary collaboration. The professional decision-making process in such situations should begin with identifying all relevant stakeholders and understanding the client's comprehensive needs and goals. The care manager must then establish clear communication channels and protocols, ensuring all team members are aware of their roles and the importance of information sharing within the bounds of privacy. Regular team meetings, shared electronic health records, where applicable and compliant, and documented case conferences are vital tools. The care manager acts as a central point of coordination, facilitating dialogue, resolving conflicts, and ensuring that the client's voice remains central to all decisions. This proactive and structured approach ensures regulatory compliance, upholds ethical standards, and ultimately promotes the highest quality of care for the client. Question 7. Comparative studies suggest that effective palliative care is deeply rooted in respecting patient autonomy and promoting comfort. Mrs. Gable, an 85-year-old client with advanced COPD and intermittent cognitive fluctuations, has repeatedly expressed a strong desire to remain at home, even if it means experiencing more breathlessness, rather than be admitted to a hospice facility. Her adult children, concerned about her safety and the burden of care, are advocating for immediate transfer to a hospice. As Mrs. Gable's certified geriatric care manager, you are aware of her fluctuating capacity. What is the most ethically and professionally sound course of action? Option A. Prioritize the children's concerns and arrange for Mrs. Gable's immediate transfer to a hospice facility, explaining to her that this is for her own safety and well-being, even if it contradicts her stated wishes. Option B. Facilitate a comprehensive assessment of Mrs. Gable's current decision-making capacity regarding her living situation and care preferences, engage in a detailed discussion with her about her goals and fears, and work collaboratively with her and her children to develop a care plan that maximizes her comfort and safety at home, exploring all available in-home support services and palliative care interventions. Option C. Focus solely on medical interventions to alleviate Mrs. Gable's breathlessness, assuming her desire to stay home is a symptom of her illness and not a reflection of her true wishes, and defer decisions about her living situation to her physicians. Option D. Inform Mrs. Gable's children that their concerns are valid and proceed with making arrangements for hospice admission based on their input, without further direct assessment of Mrs. Gable's current capacity or her explicit consent. The correct answer is B. Facilitate a comprehensive assessment of Mrs. Gable's current decision-making capacity regarding her living situation and care preferences, engage in a detailed discussion with her about her goals and fears, and work collaboratively with her and her children to develop a care plan that maximizes her comfort and safety at home, exploring all available in-home support services and palliative care interventions. Explanation. This scenario presents a common ethical dilemma in geriatric care management, specifically concerning the balance between patient autonomy and the perceived best interests of the patient, particularly when cognitive impairment is a factor. The challenge lies in navigating the wishes of a patient who may have fluctuating capacity with the responsibilities of the care manager to ensure safety and well-being, all within the framework of palliative care principles. The care manager must uphold the patient's right to self-determination while also recognizing potential limitations in their decision-making capacity. The correct approach prioritizes open communication, thorough assessment of capacity, and shared decision-making, aligning with the core tenets of palliative care, which emphasize respecting patient values and preferences. This approach ensures that the patient's voice remains central, even when difficult decisions about care are being made. It also adheres to ethical guidelines that mandate respecting autonomy and beneficence, ensuring that interventions are both desired by the patient and beneficial to their quality of life. Regulatory frameworks for geriatric care management typically mandate such patient-centered approaches, requiring care managers to advocate for their clients' wishes while ensuring their safety and dignity. An incorrect approach that overrides the patient's stated wishes without a clear, documented, and legally sound determination of incapacity is a significant ethical and regulatory failure. It violates the principle of patient autonomy and can lead to a loss of trust and a sense of disempowerment for the patient. Another incorrect approach, such as solely relying on family input without actively engaging the patient or assessing their capacity, neglects the primary directive to honor the patient's preferences. This can lead to care that is not aligned with the patient's values, potentially causing distress and undermining the goals of palliative care. A third incorrect approach, focusing solely on prolonging life without adequate consideration of the patient's quality of life and expressed wishes for comfort, directly contradicts the fundamental principles of palliative care. Professional decision-making in such situations requires a systematic process. First, assess the patient's current capacity to make decisions regarding their care. This involves observing their understanding, appreciation, reasoning, and ability to communicate a choice. Second, engage in open and honest communication with the patient, exploring their values, goals, and fears. Third, involve the family or designated surrogate decision-maker, but always with the patient's consent and participation as much as possible. Fourth, consult with the interdisciplinary care team, including physicians and palliative care specialists, to gather information and explore all available options. Finally, document all assessments, discussions, and decisions thoroughly, ensuring that the care plan reflects the patient's informed preferences and best interests, as defined by the patient. Question 8. Governance review demonstrates that a geriatric care manager is working with an elderly client who has a clearly documented advance directive specifying a desire to refuse all life-sustaining treatments, including artificial hydration and nutrition, in the event of a terminal illness or irreversible coma. The client's adult children, who are the primary decision makers in the absence of the client's capacity, are currently experiencing significant emotional distress and are pleading with the care manager to ensure their parent receives all possible interventions to prolong life, even if it contradicts the advance directive. The care manager is aware of the client's current cognitive status, which renders them unable to actively participate in this decision-making process. What is the most appropriate course of action for the geriatric care manager? Option A. Advise the family to seek legal counsel to challenge the validity of the advance directive, suggesting that their emotional distress may be grounds for invalidation. Option B. Uphold the client's advance directive and advocate for its implementation, while providing support and education to the family regarding the client's wishes and the legal implications. Option C. Agree to the family's request to provide all life-sustaining treatments, overriding the client's advance directive due to the family's emotional distress and perceived best interests. Option D. Attempt to convince the client's physician to disregard the advance directive and follow the family's wishes, citing the family's emotional state as justification. The correct answer is B. Uphold the client's advance directive and advocate for its implementation, while providing support and education to the family regarding the client's wishes and the legal implications. Explanation. Scenario analysis. This scenario presents a common yet complex ethical dilemma in geriatric care management. The challenge lies in balancing the client's stated wishes, as documented in an advance directive, with the family's current emotional distress and perceived best interests for the client. The geriatric care manager must navigate potential conflicts between legal documentation, family dynamics, and the client's autonomy, all while adhering to professional standards and regulatory requirements. The core tension is respecting the client's right to self-determination versus the family's desire to intervene based on their immediate emotional response. Correct approach analysis. The correct approach prioritizes the client's legally documented wishes as expressed in their advance directive. This aligns with the fundamental ethical principle of autonomy, which is paramount in geriatric care. Geriatric care managers are bound by regulations and ethical codes that mandate respecting a client's right to make informed decisions about their own health care, even when those decisions may be difficult for their families to accept. The advance directive serves as a clear legal and ethical guide, superseding the immediate emotional reactions of family members. The professional's role is to advocate for the client's expressed wishes and ensure they are honored. Incorrect approaches analysis. One incorrect approach would be to defer to the family's immediate emotional pleas and override the client's advance directive. This violates the client's autonomy and the legal standing of the advance directive. It also demonstrates a failure to uphold professional responsibilities to advocate for the client's wishes and could lead to legal repercussions for failing to follow documented instructions. Another incorrect approach would be to attempt to persuade the client to change their advance directive based on the family's current distress. While open communication is important, initiating a change in an advance directive solely due to family pressure, without the client initiating or fully understanding the implications, undermines the client's agency and the integrity of the advance directive process. This could be seen as undue influence. A third incorrect approach would be to simply refuse to engage with the family, leaving them to feel unheard and unsupported. While the client's wishes are paramount, a professional geriatric care manager should facilitate communication and provide education to the family about the advance directive and the client's rights, even if the outcome remains unchanged. Ignoring the family's concerns entirely is unprofessional and can exacerbate conflict. Professional reasoning. Professionals in this situation should first review the advance directive to confirm its validity and clarity. They should then schedule a meeting with the family, acknowledging their distress while firmly reiterating the client's legally documented wishes. The focus should be on educating the family about the purpose and legal weight of advance directives and the client's right to self-determination. The professional should act as a mediator and advocate for the client, ensuring that the care plan aligns with the advance directive. If the family remains resistant, the professional may need to consult with legal counsel or the client's physician to ensure all parties understand their obligations and the client's rights. Question 9. To address the challenge of a client who, following a comprehensive geriatric assessment revealing mild cognitive impairment and a history of falls, insists on living alone in their multi-story home despite expressing a desire to remain independent, which of the following approaches best upholds professional, ethical, and regulatory standards for certified geriatric care managers in the U.S.? Option A. Engage in a detailed discussion with the client to explore their specific concerns about moving, understand their coping strategies for managing potential risks at home, and collaboratively develop a safety plan that may include assistive devices, regular check-ins, and emergency preparedness measures, while also educating them on the risks associated with their current living situation. Option B. Respect the client's wishes without further discussion, as the desire for independence is a fundamental right, and it is not the geriatric care manager's role to impose living arrangements. Option C. Focus solely on the recommendations of the adult children who are concerned about their parents' safety and have suggested a move to an assisted living facility, as their input is crucial for ensuring the client's well-being. Option D. Immediately inform the client's adult children that their parent is unsafe and requires relocation, as their safety is paramount and the assessment clearly indicates a risk of falls. The correct answer is A. Engage in a detailed discussion with the client to explore their specific concerns about moving, understand their coping strategies for managing potential risks at home, and collaboratively develop a safety plan that may include assistive devices, regular check-ins, and emergency preparedness measures, while also educating them on the risks associated with their current living situation. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's stated wishes and the geriatric care manager's professional judgment regarding their safety and well-being, as informed by a comprehensive geriatric assessment. The core of the challenge lies in balancing client autonomy with the duty of care, particularly when cognitive or physical limitations may impair the client's ability to make fully informed decisions. Careful judgment is required to navigate this ethical tightrope, ensuring the client's dignity and rights are respected while also safeguarding them from harm. The correct approach represents best professional practice because it prioritizes a collaborative and client-centered process. It involves open communication with the client, exploring the underlying reasons for their preferences, and educating them about potential risks and benefits. This approach aligns with the ethical principles of autonomy, beneficence, and non-maleficence, as well as the regulatory framework that emphasizes person-centered care and the right of individuals to make choices about their own lives, even if those choices carry some risk. It also acknowledges the importance of involving family or other support systems when appropriate and with the client's consent to ensure a holistic understanding of the situation and to foster a supportive environment for decision-making. An incorrect approach that involves overriding the client's wishes without thorough exploration and consent would represent a significant ethical failure. It infringes upon the client's autonomy and right to self-determination, potentially leading to a breakdown of trust and a feeling of disempowerment. Such an action could also violate regulatory guidelines that mandate informed consent and client participation in care planning. Another incorrect approach that focuses solely on the family's desires without adequately addressing the client's perspective would also be professionally unacceptable. While family input is valuable, the primary focus of geriatric care management is the client. Disregarding the client's voice in favor of family preferences undermines their agency and can lead to care plans that are not aligned with their actual needs or desires, potentially causing distress and resistance. A third incorrect approach that involves immediately escalating the situation to external authorities without attempting to resolve the issue through communication and support would be premature and could be seen as an abdication of professional responsibility. While there are circumstances where reporting is necessary, it should be a last resort after all other avenues for client-centered problem-solving have been exhausted. This approach fails to uphold the principle of least restrictive intervention and can damage the therapeutic relationship. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough, comprehensive geriatric assessment to gather all relevant information about the client's physical, cognitive, social, and emotional status. Second, engage in open and empathetic communication with the client to understand their preferences, values, and the rationale behind their decisions. Third, educate the client about potential risks, benefits, and alternatives in a clear and understandable manner. Fourth, involve family or other support persons as appropriate and with the client's consent to gain a broader perspective and foster collaboration. Fifth, document all assessments, discussions, and decisions meticulously. Finally, if a significant safety risk remains and the client's capacity is compromised, consult with the interdisciplinary team, legal counsel, or ethics committee as per established protocols, always prioritizing the client's best interests while respecting their rights. Question 10. System analysis indicates a certified geriatric care manager, CGCM, is working with an elderly client who is experiencing significant cognitive decline, making it difficult for them to manage their finances and make sound healthcare decisions. The client's adult children are concerned about their parents' vulnerability to exploitation and are seeking guidance on how to legally protect their parents' assets and ensure appropriate care. The CGCM must advise the family on the most appropriate legal avenues within the specified jurisdiction. Which of the following approaches best aligns with professional standards and regulatory requirements for a CGCM in this situation? Option A. Guide the family on how to present information to the court that would support a finding of incapacity, even if the evidence is not entirely conclusive. To expedite the appointment of a guardian or conservator. Option B. Recommend initiating the legal process for guardianship or conservatorship, emphasizing the need for a court-appointed determination of the client's capacity and the appointment of a legally authorized decision-maker, and advise consulting with an elder law attorney to navigate these procedures. Option C. Advise the family that since the client is expressing a desire to remain independent, the CGCM should simply document these wishes and continue to monitor the situation without pursuing formal legal interventions. Option D. Suggest that the family members collectively take over management of the client's finances and healthcare decisions, as they are the most familiar with the client's needs, bypassing any formal legal proceedings. The correct answer is B. Recommend initiating the legal process for guardianship or conservatorship, emphasizing the need for a court-appointed determination of the client's capacity and the appointment of a legally authorized decision-maker, and advise consulting with an elder law attorney to navigate these procedures. Explanation. This scenario is professionally challenging because it requires a geriatric care manager, GCM, to navigate the complex legal and ethical landscape of guardianship and conservatorship, balancing the client's autonomy with the need for protection. The GCM must understand the specific legal distinctions and procedural requirements within the relevant jurisdiction to ensure they are acting in the client's best interest and within legal boundaries. The correct approach represents best professional practice because it prioritizes a thorough understanding of the legal framework governing guardianship and conservatorship. This involves identifying the specific legal processes, the criteria for establishing each, and the roles and responsibilities of the appointed parties. By consulting with legal counsel specializing in elder law, the GCM ensures that any proposed actions or recommendations are legally sound and ethically compliant with the jurisdiction's statutes and case law. This proactive legal consultation safeguards the client's rights and the GCM's professional integrity. An incorrect approach that focuses solely on the client's expressed wishes without considering their capacity to make informed decisions or the legal requirements for guardianship/conservatorship fails to uphold the client's safety and well-being. This could lead to situations where the client makes detrimental decisions due to diminished capacity, and the GCM, by not initiating appropriate legal protective measures, could be seen as negligent. Another incorrect approach that involves unilaterally assuming decision-making authority without proper legal appointment is a direct violation of legal statutes. Guardianship and conservatorship are formal legal processes that grant specific powers. Bypassing these processes constitutes an unauthorized assumption of control, which is illegal and unethical. A further incorrect approach that involves advising the family on how to circumvent legal requirements for guardianship/conservatorship is also a significant ethical and legal breach. GCMs are bound by professional codes of conduct that prohibit facilitating illegal or unethical actions. Their role is to provide objective guidance and support within the legal and ethical framework, not to subvert it. The professional decision-making process for similar situations should involve a systematic evaluation of the client's capacity, a clear understanding of their needs and wishes, and a comprehensive assessment of available legal and support resources. When concerns about capacity and safety arise, the GCM must consult with legal professionals to determine the most appropriate legal pathway, whether it be guardianship, conservatorship, or less restrictive alternatives, always prioritizing the client's dignity, autonomy, and legal rights within the governing jurisdiction. Question 11. Risk assessment procedures indicate that an 82-year-old client living alone has experienced 3 falls in the past 6 months, is exhibiting increasing forgetfulness and difficulty with daily tasks, and has significantly reduced social interactions, expressing feelings of loneliness. The client's primary care physician has noted a new prescription for a mild sedative for sleep. Which of the following actions best represents a comprehensive and effective initial response for a certified geriatric care manager? Option A. Immediately recommend a move to an assisted living facility to ensure 24-hour supervision and reduce the risk of further falls, and suggest cognitive exercises to address forgetfulness. Option B. Advise the client to discontinue the new sedative prescription and encourage them to increase their physical activity to improve balance, while suggesting they call family more often to combat loneliness. Option C. Focus solely on the falls by arranging for physical therapy and installing grab bars in the bathroom, as this is the most immediate life-threatening concern. Option D. Initiate a referral for a comprehensive medication review by a geriatric pharmacist and schedule an in-home safety assessment to identify environmental hazards contributing to falls, while also exploring the client's current social support network and potential for engagement in community programs. The correct answer is D. Initiate a referral for a comprehensive medication review by a geriatric pharmacist and schedule an in-home safety assessment to identify environmental hazards contributing to falls, while also exploring the client's current social support network and potential for engagement in community programs. Explanation. This scenario presents a common challenge in geriatric care management: the identification and management of multiple, interacting geriatric syndromes in an individual. The professional challenge lies in distinguishing the primary drivers of the client's decline from secondary or contributing factors, and in developing a holistic care plan that addresses the root causes and mitigates risks effectively. The client's presentation of falls, cognitive changes, and social isolation are not isolated issues but are likely interconnected, a hallmark of complex geriatric presentations. The correct approach prioritizes a comprehensive, interdisciplinary assessment to understand the interplay of these syndromes. This aligns with best professional practices for certified geriatric care managers, CGCM, as outlined by relevant professional bodies and ethical guidelines, which emphasize a person-centered, holistic approach. By focusing on identifying the underlying causes of the falls, e.g., polypharmacy, gait instability, environmental hazards, cognitive impairment, and the factors contributing to cognitive decline and social isolation, e.g., depression, lack of engagement, physical limitations, the CGCM can develop targeted interventions. This approach respects the client's autonomy and promotes their well-being by addressing the multifactorial nature of their challenges. An incorrect approach would be to address each symptom in isolation, without considering their interconnectedness. For instance, solely focusing on physical therapy for falls without investigating potential medication side effects or cognitive contributions would be a failure to conduct a thorough assessment. Similarly, recommending social activities without addressing underlying depression or mobility issues would be ineffective. Such fragmented approaches fail to meet the ethical obligation to provide comprehensive care and may lead to suboptimal outcomes, increased risks, and wasted resources. Regulatory frameworks for geriatric care management emphasize the importance of a holistic, individualized care plan that addresses the totality of a client's needs, not just presenting symptoms. Ignoring the interplay of syndromes constitutes a failure to adhere to these standards. Professionals should employ a systematic decision-making process that begins with a broad assessment of all presenting issues. This involves active listening, careful observation, and gathering information from multiple sources: client, family, healthcare providers. The next step is to analyze the data, looking for patterns and potential causal relationships between symptoms and underlying conditions. Based on this analysis, a prioritized list of problems and potential interventions is developed. Finally, the CGCM collaborates with the client and their support system to implement and monitor the care plan, making adjustments as needed. This iterative process ensures that care remains responsive to the client's evolving needs and addresses the complex realities of geriatric syndromes. Question 12. The control framework reveals a situation where an elderly client, diagnosed with mild cognitive impairment, expresses a strong desire to continue living independently in their home, despite evidence of increasing safety risks such as unmanaged medications and a recent fall. As a certified geriatric care manager, CGCM, which of the following ethical decision-making approaches best aligns with regulatory requirements and professional standards? Option A. Immediately arrange for the client to move to an assisted living facility, as their safety is compromised and their expressed desire is no longer a primary consideration. Option B. Initiate a comprehensive capacity assessment, and if deemed lacking, develop a care plan that prioritizes safety, involving family and healthcare providers, while exploring all less restrictive options before considering a move. Option C. Respect the client's wish to remain independent without further intervention, as their autonomy is paramount, and any attempt to alter their living situation would be a violation. Option D. Defer the decision to the client's adult children, as they are best positioned to understand the family's wishes and make the final determination regarding their parents' care. Correct answer is B. Initiate a comprehensive capacity assessment, and if deemed lacking, develop a care plan that prioritizes safety, involving family and healthcare providers, while exploring all less restrictive options before considering a move. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's stated wishes and the geriatric care manager's assessment of their best interests, particularly when cognitive impairment is a factor. The geriatric care manager must navigate the ethical principles of autonomy, respecting the client's right to make decisions, and beneficence, acting in the client's best interest to prevent harm. The regulatory framework for certified geriatric care managers, CGCM, emphasizes a client-centered approach while also mandating professional responsibility to ensure safety and well-being, especially when capacity is questionable. The correct approach prioritizes a structured ethical decision-making model that systematically evaluates the situation, identifies ethical principles at play, explores options, and seeks consultation. This aligns with professional standards that require a thorough and documented process when faced with complex ethical dilemmas. It ensures that decisions are not made impulsively, but are grounded in ethical reasoning and professional judgment, ultimately protecting the client and the professional. An approach that solely relies on the client's expressed wishes without assessing capacity or considering potential harm fails to uphold the principle of beneficence and may violate regulatory requirements to ensure client safety. Conversely, an approach that immediately overrides the client's wishes based on a subjective assessment of their best interests, without a formal capacity evaluation or exploring less restrictive alternatives, can infringe upon the client's autonomy and lead to a breakdown of trust. An approach that avoids the difficult decision altogether, deferring responsibility without adequate justification or consultation, demonstrates a failure to engage with the ethical obligations of the role and could leave the client vulnerable. Professionals should utilize a systematic ethical decision-making process. This typically involves 1. Identifying the ethical problem. 2. Gathering relevant information, including assessing the client's capacity. 3. Identifying the ethical principles involved: autonomy, beneficence, non-maleficence, justice. 4. Exploring alternative courses of action. 5. Weighing the alternatives based on ethical principles and professional judgment. 6. Making a decision and implementing it. 7. Evaluating the outcome. Seeking consultation with supervisors, ethics committees, or legal counsel is crucial when uncertainty exists. Question 13. Consider a scenario where an 85-year-old client who has consistently expressed a desire to remain in their home despite increasing frailty is being pressured by their adult children to move into an assisted living facility. The children cite safety concerns and their own inability to provide adequate support as their primary reasons. The client, while acknowledging some difficulties, remains adamant about staying home and has a clear understanding of the risks involved. As a certified geriatric care manager, what is the most appropriate course of action to advocate for the patient's rights? Option A. Inform the adult children that their concerns are valid and begin the process of researching and arranging for the client's admission into an assisted living facility, as their safety is the primary concern. Option B. Advise the adult children that they have the legal right to make decisions for their parent if they believe the parent is no longer capable, and encourage them to pursue guardianship proceedings. Option C. Facilitate a meeting with the client and their adult children to openly discuss the client's wishes, their understanding of the risks and benefits of their current living situation, and explore potential in-home support services that could address the family's concerns while respecting the client's autonomy. Option D. Respect the adult children's wishes and inform the client that, given their children's concerns, it would be in their best interest to move to an assisted living facility to ensure their safety. The correct answer is C. Facilitate a meeting with the client and their adult children to openly discuss the client's wishes, their understanding of the risks and benefits of their current living situation, and explore potential in-home support services that could address the family's concerns while respecting the client's autonomy. Explanation: this scenario is professionally challenging because it requires a geriatric care manager, GCM, to navigate a complex family dynamic while upholding the client's autonomy and rights, which are paramount in geriatric care management. The GCM must balance the family's concerns with the client's expressed wishes, ensuring that the client's dignity and self-determination are respected. The GCM's role is to advocate for the client, not to make decisions for them or to be swayed by familial pressure that may not align with the client's best interests or legal rights. The correct approach represents best professional practice because it prioritizes the client's expressed wishes and legal rights, which are foundational principles in geriatric care management. This aligns with the ethical guidelines and regulatory frameworks that emphasize client autonomy, informed consent, and the right to self-determination. By directly addressing the client's concerns and exploring their understanding of the situation, the GCM is actively engaging in person-centered care and fulfilling their advocacy role. This approach respects the client's capacity to make decisions about their own life, even if those decisions are not what others might prefer. An incorrect approach that involves overriding the client's decision based solely on the family's insistence would be a significant ethical and regulatory failure. This would violate the client's right to autonomy and could be construed as elder abuse or undue influence, depending on the specific circumstances and applicable laws. Another incorrect approach, such as unilaterally informing the family of the client's private medical information without consent, would breach confidentiality and violate privacy regulations. Failing to explore the client's reasoning or offering unsolicited advice that undermines their choices would also be a failure to advocate effectively and could lead to a loss of trust and a compromised care plan. Professionals should employ a decision-making framework that begins with identifying the client's stated wishes and understanding their capacity. This involves open communication with the client, exploring their rationale, and ensuring they have sufficient information to make informed decisions. If capacity is a concern, a formal assessment should be pursued. The GCM must then consider the legal and ethical obligations, including privacy, autonomy, and the duty to advocate. Engaging all relevant parties, including the client, family, and healthcare providers, in a collaborative discussion, while always centering the client's voice and rights, is crucial. The GCM acts as a facilitator and advocate, ensuring the client's voice is heard and respected throughout the process. Question 14. The investigation demonstrates that an elderly client, Mr. Henderson, has recently exhibited increased forgetfulness, difficulty with financial management, and occasional disorientation regarding time and place. His adult children are concerned and have requested a comprehensive care plan. As a certified geriatric care manager, CGCM, what is the most appropriate initial step to take in developing this plan, considering the potential impact of cognitive changes on his decision-making capacity? Option A. Immediately implement a restrictive care plan based on the family's concerns, assuming Mr. Henderson is no longer capable of making sound decisions due to his reported forgetfulness. Option B. Conduct a thorough cognitive assessment, utilizing standardized tools and direct observation of Mr. Henderson's daily functioning to objectively evaluate his capacity to make decisions regarding his care and finances. Option C. Proceed with developing a standard care plan for age-related memory changes without specifically assessing Mr. Henderson's current cognitive abilities or decision-making capacity. Option D. Rely solely on the detailed accounts provided by Mr. Henderson's children to formulate the care plan, as they are most familiar with his recent behaviors. Correct answer is B. Conduct a thorough cognitive assessment, utilizing standardized tools and direct observation of Mr. Henderson's daily functioning to objectively evaluate his capacity to make decisions regarding his care and finances. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a client with potential cognitive decline, which directly impacts their ability to provide informed consent and make decisions about their care. The geriatric care manager must balance the client's autonomy with the need to ensure their safety and well-being, all while adhering to ethical and regulatory standards regarding capacity assessment. The risk of misinterpreting cognitive changes or overstepping boundaries is significant. Correct approach analysis. The correct approach involves a systematic and multifaceted assessment of the client's cognitive function. This aligns with best professional practices for geriatric care managers, emphasizing a person-centered approach. Regulatory frameworks and ethical guidelines for certified geriatric care managers, CGCM, mandate that decisions regarding care plans and interventions must be based on an accurate understanding of the client's capacity. A comprehensive cognitive assessment, potentially involving standardized tools and observation of daily functioning, allows the CGCM to determine the extent of any cognitive impairment and its impact on decision-making ability. This information is crucial for developing an appropriate care plan that respects the client's wishes while ensuring their safety and quality of life, and it forms the basis for any necessary discussions about surrogate decision-making or legal guardianship if capacity is found to be lacking. Incorrect approach is analysis. One incorrect approach would be to immediately assume the client lacks capacity based on a single observation or a general impression of forgetfulness. This fails to adhere to the principle of presumed capacity, which is a cornerstone of ethical practice and often reflected in regulatory guidelines. It bypasses the necessary steps of a formal assessment and could lead to an unwarranted infringement on the client's autonomy and rights. Another incorrect approach would be to rely solely on family reports without conducting an independent assessment of the client's cognitive status. While family input is valuable, it is subjective and may be influenced by their own biases or anxieties. Regulatory and ethical standards require the CGCM to gather objective data directly from the client and through professional assessment to make informed judgments about capacity. A third incorrect approach would be to proceed with a care plan that significantly alters the client's lifestyle or living situation without a clear understanding of their cognitive abilities and their ability to consent to such changes. This could lead to a care plan that is not aligned with the client's actual needs or preferences, potentially causing distress and resistance, and failing to meet the standard of care expected of a CGCM. Professional reasoning. When faced with a situation suggesting potential cognitive decline, a CGCM should initiate a structured decision-making process. This begins with recognizing the signs and symptoms that warrant further investigation. The next step is to gather information from multiple sources, including the client family and any existing medical records. Crucially, this must be followed by a direct, professional assessment of the client's cognitive function, utilizing appropriate tools and observation. Based on the assessment findings, the CGCM can then determine the client's capacity to make specific decisions. If capacity is intact, the client's wishes should guide the care plan. If capacity is impaired, the CGCM must follow established protocols for involving surrogate decision makers or exploring legal avenues, always prioritizing the client's best interests and adhering to all relevant regulations and ethical codes. Question 15. Upon reviewing Mr. Henderson's resistance to the proposed in-home safety modifications, which he states are unnecessary and make him feel like a prisoner, what is the most effective communication technique to encourage his cooperation while respecting his desire for independence? Option A. Present a complex technical report detailing the statistical likelihood of accidents without these modifications, assuming he will understand the data and its implications. Option B. Firmly explain that these modifications are mandatory for his safety and that he has no choice but to accept them to prevent serious injury. Option C. Acknowledge his feelings about feeling like a prisoner and explain how the modifications, such as grab bars and improved lighting, are specifically designed to prevent falls, thereby enabling him to maintain his independence and continue living safely in his own home for longer. Option D. Minimize his concerns by stating that these are minor changes and that he is overreacting to the idea of increased safety measures. The correct answer is C. Acknowledge his feelings about feeling like a prisoner and explain how the modifications, such as grab bars and improved lighting, are specifically designed to prevent falls, thereby enabling him to maintain his independence and continue living safely in his own home for longer. Explanation. Scenario analysis. This scenario presents a common challenge in geriatric care management, navigating a client's resistance to necessary interventions due to cognitive changes and a desire for independence. The professional must balance respecting the client's autonomy with ensuring their safety and well-being, a delicate ethical and practical tightrope. The challenge is amplified by the potential for misinterpretation of the client's cues and the need to adapt communication strategies in real time. Correct approach analysis. The most effective approach involves validating the client's feelings and concerns while gently reframing the proposed solution in terms of their stated goals and values. This respects their autonomy by acknowledging their perspective and seeks to build trust by demonstrating understanding, by linking the intervention to their desire for independence, e.g. This will help you stay independent longer. The care manager aligns the proposed action with the client's own motivations, making it more palatable. This aligns with ethical principles of beneficence, acting in the client's best interest and respect for autonomy, as mandated by professional standards for certified geriatric care managers, which emphasize person-centered care and informed consent, even when cognitive capacity is fluctuating. Incorrect approaches analysis. One incorrect approach involves dismissing the client's concerns and insisting on the intervention. This disregards the client's feelings and autonomy, potentially eroding trust and leading to further resistance. Ethically, this violates the principle of respect for persons and can be seen as paternalistic, failing to engage the client collaboratively. Another incorrect approach is to present the intervention as a non-negotiable requirement without explaining the rationale or addressing the client's fears. This fails to provide adequate information for informed decision-making and can be perceived as coercive, undermining the client's right to self-determination. Professional guidelines for CGCM stress the importance of clear, understandable explanations and collaborative goal setting. A third incorrect approach is to oversimplify the explanation or use jargon, assuming the client understands without checking for comprehension. This can lead to misunderstandings and a feeling of being patronized, further hindering effective communication and potentially leading to noncompliance. Professional practice requires tailoring communication to the individual's cognitive and sensory abilities. Professional reasoning. When faced with a client's resistance, a geriatric care manager should employ a problem-solving approach that prioritizes understanding the root cause of the resistance. This involves active listening, empathetic validation of feelings, and collaborative exploration of solutions. The professional should assess the client's cognitive status and communication abilities to tailor their approach. The goal is to empower the client to make informed decisions about their care, even when those decisions require support or modification of their current routines. This process involves ethical considerations of beneficence, non-maleficence, autonomy, and justice, all of which are foundational to the CGCM Code of Ethics. Question 16. The monitoring system demonstrates that Mr. Henderson, a 78-year-old client with a recent diagnosis of mild cognitive impairment, has been consistently refusing recommended home safety modifications, despite his daughter expressing significant concern about his fall risk. The geriatric care manager needs to proceed with a plan for these modifications. What is the most appropriate course of action? Option A. Contact Mr. Henderson's daughter to obtain her consent for the modifications, as she is his primary caregiver and has expressed the most concern. Option B. Engage Mr. Henderson in a detailed discussion about the proposed safety modifications, using simplified language and visual aids to explain the risks of falls and the benefits of the modifications, and assess his understanding before proceeding. Option C. Immediately proceed with the installation of the safety modification, as his daughter has expressed significant concern and Mr. Henderson's cognitive impairment suggests he may not fully grasp the risks. Option D. Document Mr. Henderson's refusal and inform his daughter that no further action can be taken without his explicit consent, even if it means leaving him at risk. Correct answer is B. Engage Mr. Henderson in a detailed discussion about the proposed safety modifications, using simplified language and visual aids to explain the risks of falls and the benefits of the modifications, and assess his understanding before proceeding. Explanation. This scenario presents a common challenge in geriatric care management, where a client's cognitive status may fluctuate, impacting their ability to provide truly informed consent. The professional's duty is to uphold the client's autonomy while ensuring their safety and well-being, navigating the complexities of diminished capacity. This requires a nuanced understanding of legal and ethical obligations regarding consent in vulnerable populations. The correct approach prioritizes obtaining consent directly from the client to the greatest extent possible, even if it requires additional time and effort to ensure comprehension. This aligns with the ethical principle of respecting autonomy and the legal requirement for informed consent, which necessitates that the individual understands the nature, risks, benefits, and alternatives of proposed interventions. When cognitive impairment is present, the geriatric care manager must employ strategies to facilitate understanding, such as using simpler language, visual aids, or breaking down information into smaller segments. If the client, despite these efforts, cannot demonstrate understanding or make a reasoned decision, then the process must escalate to involving a legally authorized representative, ensuring that decisions are made in the client's best interest and according to their known wishes. This upholds the client's dignity and legal rights. An incorrect approach would be to bypass the client entirely and seek consent solely from a family member, without first assessing the client's capacity or attempting to involve them in the decision-making process. This fails to respect the client's autonomy and may violate regulations that mandate direct consent from the individual whenever possible, even with cognitive impairment. Another incorrect approach is to assume that because a client has a diagnosis of cognitive impairment, they are incapable of providing any level of consent. This paternalistic stance disregards the spectrum of cognitive function and the individual's right to participate in decisions about their own care. Proceeding with interventions without any form of consent, either from the client or an authorized representative, constitutes a significant ethical and legal breach, potentially leading to legal repercussions and a loss of trust. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's cognitive capacity for the specific decision at hand. This involves observing the client's ability to understand information, appreciate the consequences of their choices, and communicate a choice. If capacity is present, direct informed consent should be obtained. If capacity is questionable or absent, the professional must then determine if a legally authorized representative exists and is available. If so, consent should be sought from that representative, ensuring they are acting in the client's best interest. If no representative is available and the situation is urgent, the professional must act in accordance with emergency protocols and best interests, documenting all steps meticulously. Question 17. Examination of the data shows that a geriatric care manager is working with a client diagnosed with type 2 diabetes and hypertension. The client reports experiencing significant fatigue and occasional dizziness, which they attribute to their current medication regimen prescribed by their physician. The client expresses a desire to explore alternative medication options or dosage adjustments. The geriatric care manager has reviewed the client's current medication list and understands the physician's rationale for the prescribed treatment. What is the most appropriate next step for the geriatric care manager? Option A. Document the client's reported symptoms in their file and wait for the physician to initiate a follow-up appointment. Option B. Inform the client that fatigue and dizziness are common side effects of these conditions and medications, and that they should learn to live with them. Option C. Advise the client to stop taking their prescribed medications until they can see the physician to see if symptoms improve. Option D. Facilitate a discussion between the client and their physician to address the reported symptoms and explore potential adjustments to the medication regimen. The correct answer is D. Facilitate a discussion between the client and their physician to address the reported symptoms and explore potential adjustments to the medication regimen. Explanation. Scenario analysis. This scenario presents a common challenge in geriatric care management where a client's chronic disease management plan, established by a physician, may not fully align with the client's expressed preferences and daily lived experience. The professional's role is to advocate for the client, while respecting the medical expertise and ensuring adherence to established care protocols. The challenge lies in balancing these potentially competing priorities without undermining the physician's authority or the client's autonomy. Correct approach analysis. The most appropriate approach involves facilitating a collaborative discussion between the client and their physician. This respects the physician's medical judgment and the established care plan, while also empowering the client to voice their concerns and preferences. By bringing these issues to the physician, the geriatric care manager ensures that any adjustments to the chronic disease management plan are medically sound and informed by the client's direct feedback. This aligns with ethical principles of client-centered care, informed consent, and professional collaboration, as mandated by typical geriatric care management standards that emphasize interdisciplinary communication and client advocacy. Incorrect approaches analysis. One incorrect approach would be to unilaterally advise the client to disregard the physician's prescribed medication regimen. This bypasses the physician's expertise and could lead to adverse health outcomes, violating the principle of acting in the client's best interest and potentially breaching professional duty of care. It also undermines the established physician-client relationship. Another incorrect approach would be to simply document the client's complaints without initiating further action or communication with the physician. This passive stance fails to adequately advocate for the client's needs and could result in continued suboptimal management of their chronic conditions, neglecting the professional responsibility to ensure effective care coordination. A third incorrect approach would be to dismiss the client's concerns as minor or typical for their condition, without further investigation or discussion with the physician. This demonstrates a lack of empathy and a failure to recognize that a client's subjective experience is a crucial component of effective chronic disease management. It overlooks the potential for underlying issues or the need for treatment adjustments based on the client's quality of life. Professional reasoning. When faced with a discrepancy between a client's experience and their medical plan, a geriatric care manager should employ a systematic approach. 1. Active listening and assessment. Thoroughly understand the client's concerns and how they impact their daily life. 2. Information gathering. Review the existing care plan and relevant medical history. 3. Facilitate communication. Act as a liaison between the client and their healthcare providers to ensure all perspectives are heard and understood. 4. Collaborative problem solving. Support the client and physician in developing an adjusted plan that is both medically appropriate and addresses the client's needs and preferences. 5. Documentation. Maintain clear and accurate records of all communications and decisions. Question 18. Performance analysis shows a certified geriatric care manager, CGCM, is working with an elderly client who expresses a strong desire to remain in their home, despite family concerns about safety and the client's increasing forgetfulness. The family is advocating for a move to an assisted living facility, citing potential risks and their own stress levels. The CGCM must develop a care plan that addresses these competing priorities. Which of the following approaches best reflects professional best practice for goal setting and prioritization in this situation? Option A. Implement the most cost-effective in-home care solutions available to meet the client's basic needs, without extensively exploring the client's personal preferences for social engagement or quality of life. Option B. Focus on the family's immediate concerns about safety and stress, and recommend a move to an assisted living facility as the most prudent course of action, explaining to the client that this is for their own good. Option C. Dismiss the client's desire to stay home as unrealistic given their forgetfulness, and proceed with planning for an assisted living placement based on the family's assessment of risk. Option D. Prioritize the client's expressed desire to remain at home, and collaboratively develop a comprehensive in-home support plan that includes safety modifications, regular check-ins, and potential in-home care services, while also transparently discussing potential risks and contingency plans with both the client and family. The correct answer is D. Prioritize the client's expressed desire to remain at home and collaboratively develop a comprehensive in-home support plan that includes safety modifications, regular check-ins, and potential in-home care services, while also transparently discussing potential risks and contingency plans with both the client and family. Explanation. This scenario presents a common challenge in geriatric care management, where multiple stakeholders have differing priorities for a client. The Certified Geriatric Care Manager, CGCM, must navigate these competing interests while adhering to ethical principles and regulatory guidelines that prioritize the client's well-being and autonomy. The professional challenge lies in balancing the expressed desires of the client with the concerns of family members and the practical realities of available resources and care options, all within the scope of professional practice. The correct approach represents best professional practice because it centers the client's expressed wishes and autonomy as the paramount consideration, a core ethical and regulatory tenet in geriatric care. By actively listening to the client, validating their feelings, and then collaboratively exploring options that align with their goals, the CGCM upholds the principle of self-determination. This process involves transparent communication about limitations and potential risks, ensuring informed decision-making. This aligns with the ethical codes and practice standards that guide CGCM, emphasizing client-centered care and respect for individual preferences. An incorrect approach that solely prioritizes the family's immediate concerns without fully engaging the client's wishes fails to respect the client's autonomy and right to self-determination. This could lead to a care plan that is not truly in the client's best interest, potentially causing distress and undermining trust. Ethically, this violates the principle of beneficence and non-maleficence by not acting in the client's best interest and potentially causing harm through imposed decisions. Another incorrect approach that focuses solely on the most cost-effective solutions without adequately considering the client's quality of life or preferences disregards the holistic nature of geriatric care. While financial considerations are important, they should not override the client's fundamental needs and desires for comfort, engagement, and dignity. This approach risks creating a care plan that is technically feasible but emotionally and socially detrimental to the client, violating ethical obligations to promote well-being. A further incorrect approach that dismisses the client's expressed desires as unrealistic without thorough exploration and collaborative problem-solving is also professionally unacceptable. It demonstrates a lack of empathy and a failure to engage in the collaborative goal-setting process. This can lead to a care plan that the client feels is imposed upon them, fostering resentment and noncompliance, and failing to meet the ethical standard of client empowerment. The professional decision-making process for similar situations should involve a structured approach. First, actively listen to and understand the client's goals, values, and preferences. Second, gather information about the client's current situation, including their health status, functional abilities, and available resources. Third, engage relevant stakeholders, such as family members, in a collaborative discussion, ensuring the client remains central to the conversation. Fourth, explore a range of potential care options, discussing the pros and cons of each in relation to the client's goals and practical considerations. Fifth, collaboratively develop a care plan that reflects the client's priorities, is realistic, and is ethically sound, with ongoing reassessment and adjustment as needed. Question 19. The audit findings indicate a recurring pattern of communication breakdowns between the geriatric care manager and the primary family caregiver, leading to expressed frustration from the caregiver regarding perceived unmet needs and a lack of involvement in care decisions. The client, while generally agreeable, appears to be influenced by the caregiver's strong opinions. How should the geriatric care manager best address this situation to ensure optimal client care and professional accountability? Option A. Immediately implement all requested changes by the caregiver without further discussion, assuming their demands reflect the client's best interests to de-escalate the situation and satisfy the audit's implied concerns. Option B. Inform the caregiver that the audit is a confidential process and that their input is not directly relevant to the manager's professional responsibilities, focusing solely on implementing care plans as directed by the client. Option C. Schedule a joint meeting with the client and caregiver to openly discuss the audit findings, actively listen to the caregiver's specific concerns, explore the client's preferences and understanding of the situation, and collaboratively develop a revised communication plan that respects both parties' input while prioritizing the client's autonomy and well-being. Option D. Avoid direct confrontation with the caregiver about the audit findings, and instead subtly adjust care plans based on assumptions about the caregiver's desires, hoping to resolve the issues without explicit communication. The correct answer is C. Schedule a joint meeting with the client and caregiver to openly discuss the audit findings, actively listen to the caregiver's specific concerns, explore the client's preferences and understanding of the situation, and collaboratively develop a revised communication plan that respects both parties' input while prioritizing the client's autonomy and well-being. Explanation. Scenario analysis. This scenario is professionally challenging because it involves navigating complex family dynamics and differing perspectives on care while maintaining professional boundaries and adhering to ethical guidelines. The geriatric care manager must balance the expressed needs and desires of the primary caregiver with the potential unexpressed needs or preferences of the client, all within the context of a formal audit. The pressure of an audit adds an element of scrutiny, requiring meticulous documentation and justification of all communication strategies. Correct approach analysis. The most effective approach involves actively seeking to understand the caregiver's concerns and frustrations, while also ensuring the client's voice and autonomy are respected and documented. This aligns with ethical principles of client-centered care and informed consent, as well as best practices in geriatric care management, which emphasize collaborative decision-making. By facilitating open dialogue, exploring alternative solutions, and documenting all discussions and decisions, the manager demonstrates a commitment to both the client's well-being and transparent professional practice, which is crucial during an audit. This approach prioritizes building trust and rapport with the family, which is essential for long-term care success. Incorrect approaches analysis. One incorrect approach would be to dismiss the caregiver's concerns outright, focusing solely on the client's stated wishes, without acknowledging the caregiver's burden or perspective. This fails to uphold the ethical principle of beneficence towards the caregiver, who is a vital stakeholder in the client's care. It also risks alienating the caregiver, potentially leading to decreased cooperation and increased conflict, which would be detrimental to the client and would likely be viewed negatively in an audit. Another incorrect approach would be to implement changes based solely on the caregiver's demands without adequate assessment of the client's needs or preferences, or without exploring less intrusive alternatives. This violates the principle of client autonomy and could lead to inappropriate care interventions. It also demonstrates a lack of professional judgment and a failure to conduct a thorough, holistic assessment, which are core competencies for a certified geriatric care manager and would be a significant concern during an audit. A third incorrect approach would be to avoid direct communication with the caregiver about the audit findings and instead rely on indirect methods or assumptions. This breaches professional transparency and accountability. It fails to engage a key stakeholder in a critical process and could lead to misunderstandings or a perception of withholding information, both of which are ethically problematic and would likely be flagged during an audit. Professional reasoning. When faced with conflicting perspectives between a caregiver and a client, or when navigating sensitive family dynamics, a geriatric care manager should employ a structured, client-centered, and collaborative approach. This involves active listening, empathetic communication, thorough assessment of all parties' needs and concerns, exploration of various care options, and clear documentation of all interactions and decisions. The manager must always prioritize the client's well-being and autonomy, while also acknowledging and addressing the needs of the support system. In situations involving audits, maintaining meticulous records of these communication strategies and the rationale behind decisions is paramount. Question 20. Analysis of a certified geriatric care manager's (CGCM) Ethical and regulatory obligations arises when an adult client, who lives independently and has full cognitive capacity, expresses a strong desire to keep their medical information and care plan private from their adult children, despite the children expressing concerns to the CGCM about their parents' well-being. The CGCM has received no written authorization from the client to share any information with the children. Under U.S. federal regulations, what is the CGCM primary obligation in this situation? Option A. Contact the client's physician to discuss the situation and seek guidance on how to involve the family, even without client consent. Option B. Inform the children about the client's general health status and care needs to alleviate their concerns, as the CGCM believes family support is crucial. Option C. Assume that the children's concerns indicate a need for intervention and begin sharing relevant care details with them to ensure the client's safety. Option D. Respect the client's explicit wishes for privacy and refrain from disclosing any information to the children without the client's written consent. Correct answer is D. Respect the client's explicit wishes for privacy and refrain from disclosing any information to the children without the client's written consent. Explanation. This scenario presents a common yet complex challenge for geriatric care managers, GCM, involving the delicate balance between a client's expressed wishes and the potential need to involve family members for their well-being, all while strictly adhering to confidentiality regulations. The professional challenge lies in respecting the client's autonomy and privacy, as mandated by regulations such as the Health Insurance Portability and Accountability Act, HIPAA, in the United States, while also fulfilling the ethical duty to ensure the client's safety and quality of life, which may necessitate family involvement. Navigating this requires careful judgment, a thorough understanding of legal and ethical boundaries, and effective communication strategies. The correct approach prioritizes the client's explicit consent and autonomy, aligning with the core principles of patient privacy and confidentiality. In the U.S., HIPAA strictly governs the disclosure of protected health information, FI. Without the client's written authorization, a GCM cannot share information with family members, even if they believe it is in the client's best interest. This approach upholds the client's right to control their personal information and respects their independence. It also fosters trust, which is crucial for the therapeutic relationship between the GCM and the client. The GCM's role is to advocate for the client within the bounds of the law and ethical practice, which begins with respecting their privacy. An incorrect approach that involves disclosing information to the family without the client's consent directly violates HIPAA. This constitutes a breach of confidentiality, which can lead to significant legal penalties, including fines and reputational damage. Ethically, it undermines the client's trust and autonomy, potentially damaging the GCM-client relationship and creating a hostile environment for the client. Another incorrect approach, such as refusing to engage with the client about their family's concerns, fails to uphold the GCM's duty of care and advocacy. While privacy is paramount, a GCM should explore the client's willingness to involve family and facilitate communication if the client consents, rather than outright refusing to consider the family's perspective. A third incorrect approach, such as assuming the family's involvement is automatically beneficial and proceeding without explicit client consent, demonstrates a lack of understanding of privacy regulations and a failure to prioritize client autonomy. The professional decision-making process for similar situations should begin with a clear understanding of the client's current wishes and capacity to make decisions. The GCM should then assess the situation for any immediate safety risks. If no immediate risk is present, the GCM should discuss with the client their concerns about family involvement and explore their willingness to grant consent for information sharing or for family participation in care planning. If the client consents, the GCM should facilitate this involvement in a way that respects the client's boundaries. If the client refuses consent and there are no immediate safety risks, the GCM must respect that decision and continue to advocate for the client's needs within the established privacy framework. If there are immediate safety risks and the client lacks capacity to consent, the GCM would need to consult with legal counsel or relevant authorities to determine the appropriate course of action, always prioritizing the client's well-being within legal and ethical parameters.